As 2025 wraps up, many of us pause and ask, what's next for my fertility? Maybe this year didn't go as planned. Your cycles felt unpredictable. The testing results left you feeling confused. Before jumping into another round of supplements or IVF protocols, this is a time to slow down, reflect, and prepare intentionally for the year ahead. Let's go. Welcome back. I'm Sarah Clark, founder of FabFertile. For over a decade, my team and I have helped hundreds of couples improve their chances of pregnancy success, whether naturally or through IVF. We specialize in supporting those with low AMH, high FSH, diminished ovarian reserve, premature ovarian insufficiency, recurrent pregnancy loss through functional lab testing, and personalized fertility strategies. This episode is for you as if you spent the year focused on trying to conceive with low AMH, high FSH, diminished ovarian reserve, premature ovarian insufficiency, recurrent pregnancy loss, want to enter 2026 with a clear plan that supports your body, not overwhelms it. You're ready to reflect on what your body has been telling you, whether through irregular cycles, fatigue, stress, and make changes based on that insight, not through urgency. And you want to begin the new year with hope and strategy using a functional fertility lens to align with testing, nutrition, lifestyle for better ovarian health and emotional balance. Thanks so much for listening. I'm so thankful that you're here. Make sure you hit subscribe or follow. And if you know someone else who's on the fertility journey, please share this podcast with them. It's the end of 2025. I don't know where the time has gone. And so really now is the best time to pause. A lot of things close down during this period of time. You can be spending time with family and friends. That sometimes can be triggering, a little bit difficult, especially if you're encountering people with a lot of pregnancy announcements. I see a lot of people now saying, my whole friend group is pregnant. So it can be very difficult. So we need to be able to create some boundaries and maybe some new holiday celebrations with your partner that feels right for you. So the nervous system needs some rest. So now is the time to take some time to rest your body. It can feel, especially if you're a hyperachiever, controlling, hypervigilant kind of person, which is typically who we work with, the type A's, this fertility journey can be filled with constant doing, just checking it off the list, tracking, testing, waiting. And if the body's in fight or flight, it can't receive. The nervous system is dysregulated. We see this a lot with low AMH and high FSH, diminished ovarian reserve, premature ovarian insufficiency, recurrent pregnancy loss, nervous system dysregulation. And people will tell me, oh, I had a very high stress job a couple of years ago. I've changed it now. And now, I've reduced my hours. I've made these changes, but the body, she's catching up. And so we need to be able to, all the stuff we did to it a couple of years ago, it can take a little bit of time to restore ovarian function and improve egg quality. And if you've got an IVF coming up, typically there was a push in December for clinics. They're doing their year end. They want to get everybody rushing into IVF, and then maybe you're restarting your insurance in the new year, but we need to bring in IVF at the right time and deploy it at the right time. So if your nervous system is feeling on high alert, that could be why the embryo is not implanting. That can be why the retrieval didn't work. I see people having horrible responses to medication. I was talking to someone the other day and she just had a very poor retrieval. It was canceled and she was just devastated. Most people have done some work on their health, but we haven't done it in a targeted manner. So during this week, time to reflect, to breathe, to allow your body to shift from that hyper vigilance to receptivity, to knowing that the majority of us can get pregnant naturally. That your body, she's trying to tell you something. And it's not just about you working on your health, your partner too. Because this can really tear a relationship apart or bring you guys closer together. Because it's not just about you going, oh, it's all baby making. If we want intimacy, we want to be able to deepen our connection, have you on the same page. Especially if you're dealing with secondary fertility issues, I can see sometimes where the man's, I feel content with one. With the woman, it's a biological need to expand. Or other times a man equally wants another child in the family. The secondary infertility piece, we work with a lot of people that have that easy breezy, having your child the first time, and then the second time, these diagnoses, the POI, the DOR, the low AMH, the high FSH, the recurrent loss seems to come out of nowhere. Well, you've gotten pregnant, you've breastfed. You need to boost up your nutrients and boost up your health and get you ready for the second child. Right now, as we are about to head into 2026, we can reflect on what's worked and what didn't. So what changes truly made you feel better? How is your energy? How is your sleep? How is your digestion? How is your mood? Like all these pieces, there can be the mental emotional side of things and also the biochemical side of things. So we think we're just an irritable, cranky, depressed person. Maybe it's because of all of our nutrients were low. And if we start to boost those up, it can improve. But we also need the mindset help too. There's just a lot of stress with this. You can feel like you're stuck and in a bad position. You're comparing. Comparison is a thief of joy. You're comparing yourself to others. We can look back on this year, which supplements or strategies felt forced or stressful. Taking a boatload of supplements with really not knowing if they're right for you. As part of our Fab Fertile method, we ship testing worldwide. The protocols are based on your biomarkers, your blood work, your testing, and then you know why you're taking them. A lot of times they're like, I'm just taking ashwagandha, I'm taking some maca, some bee pollen, I got to take some NAC, all these different fertility supplements, but maybe you just have expensive pee. If we don't really know why we're taking something or doing something, it could just feel not purposeful. And so when we do something that's individualized for us, it can help you understand why. That is key. So this year, did you address the underlying imbalances that might be impacting your cycle? So if your cycle has been irregular, or if you haven't been ovulating, or you still have PMS, or you have cramping, or you have heavy periods, or it's painful periods shouldn't be all this pain and taking all this medication to get through it. No, that's a signal that something's out, or maybe yours have been very irregular. And so rushing to IVF, when we haven't looked at those underlying imbalances, so what's driving it, the health of your gut. You don't need to have digestive issues, diarrhea, constipation, burping, bloating, but those are definitely a sign. If you have them, if you have GERD or acid reflux, those are definitely a sign something's going on with your digestion. But with gut issues, you can have the mood issues, the joint, the skin, autoimmune. That can be signaling issues with your gut health. The thyroid, talked a lot about the thyroid health. So we don't want normal. Don't take it that they tell you it's normal. We want optimal. It's regularly missed. Inflammation. So is there just inflammation in your body? Then we can look at your high sensitivity C-reactive protein. And maybe your nervous system is dysregulated and that's just caused all of this. So did we look at those underlying imbalances before we go and deploy a PRP, a IVF, a IUI, Medicaid cycle? We need to look at your health. And from a functional standpoint, our Fab Fertile method is about listening to the feedback that your body is giving you. Each day she's telling you something. Wait a minute, my cycle is off. Oh, I've got this bloating. Oh, I have a headache. Oh, I feel irritable. Like all these signals, the body is whispering to you. And right now, the reproductive health has been deprioritized. And as we start to listen to those little signals, that's what's going to help improve egg quality, ovarian function, the embryo making it, and implantation. So it's all connected. As you move into 2026, it's time to look at your labs. If it's been 6 to 12 months, retest your biomarkers, your thyroid, your iron. I've done podcasts on thyroid, done podcasts on iron and ferritin, your vitamin D. We like between 60 to 80, your high sensitivity C-reactive protein. Depending on how triggering it can be, look at your AMH and your FSH. Look at your gut health. Get some clarity on the testing. Support your mitochondria. Looking at your sleep. If you have insomnia, your sleep is dysregulated, you should go to bed, wake up 8 hours, feel great. If it's off, that can then impact your blood sugar. That can impact your ovarian reserve. You're making sure you're getting enough protein. Looking at the minerals. They're just spark plugs the body. Maybe yours are just low. Looking at some CoQ10 or ubiquinol. That's the foundation of good egg quality. They can't test for it, but looking at your egg quality. Improve your stress recovery. So build in nervous system regulation practices. So some breath work, breathing in for 4, holding for 8, and then out for 7. Walking, some acupuncture if it feels good for you. Therapy, like talking about this stuff, right? Sometimes we just push it all down. I'm fine, don't worry about me. Meanwhile, we need to get it out and give voice to us. That's why we have mindset coaches to be able to help with this. Journaling, whatever feels right for you. And then choose your next step intentionally, not out of fear, where the doctor's, okay, time for IVF. Just because they think it's time for IVF, we need to make sure you feel it's time for IVF and not just blatantly trusting the doctors. We need to deploy them at the right time and have you looked at all your testing and your biomarkers to make an informed decision to spend a whole bunch of money over there on something that may not work. And if you can get pregnant naturally, we need to deploy it at the right time. We're not anti-IVF, whether it's trying naturally. Sometimes we need to take a pause on trying naturally. We see people's bodies fire up, they have a pregnancy loss. That sets you back even further. So some of our protocols, it's going to be contraindicated to try. So we want you to take a pause. You're still having intimacy, but not actively trying, because we don't want you to have a loss, especially if you have had loss. It's not about just forging forward and keep going. That is your superpower. We got people having multiple losses, and it sets you back. And so we need to understand what's happening with that. So the genetic testing be really powerful to personalize this and seeing what is causing inflammation in the body and why it's not working. And also looking at your partner, looking at his DNA fragmentation, his sperm. It's not just about looking at your health. So it's about being aligned, not feeling rushed. We don't want to feel rushed or panicked. That's not how we bring in our baby when you're like, oh my goodness, I'm too old, it's too late. No, we need to go in knowing we've worked on our health and feeling calm, and that's when it works. Many women conceive after they work on their health. We see it all the time. And many times people, I'm just thinking of one where she recently had her son, and she'd done our Fab Fertile method for about a year, decided she wanted to go to the fertility clinic. As she was preparing for the stimulation protocol, she found out she was pregnant naturally. Sometimes when we calm down and think about our next steps, we've seen that a lot, where people go in for the retrieval, they're pregnant. They decide to go to IVF, and about to start, they find they're pregnant. But they've done the work, right? They've made the changes. And then they decide when to deploy the next step. And so healing is not linear, right? You can be like, feel good, and then you slip down all over the place. Acknowledge all the good things we've done this year to improve our health. And then go in for 2026 in a targeted way, looking at some testing, looking at your biomarkers, looking at the nervous system dysregulation, decide when it's right for you to deploy the IVF. Make sure you hire a team around you that specializes in this. Don't just throw money and waste it on practitioners that don't specialize in POI or recurrent pregnancy loss or diminished ovarian reserve, because you're going to miss themes. We see these themes all the time where you're like, I don't need mindset. That's the person that needs the mindset the most. Or I feel so panicked, or I just want to bring back in gluten. When can I have it? You shouldn't be addicted to a food. If you can't wait to eat gluten again, because there's so many gluten-free options, and maybe you don't have celiac, but it's non-celiac gluten sensitivity, and that's causing inflammation in your body. So if there's a certain food, you're like, oh, I need to have the cheese again. No, it's taking those foods out for 60 to 90 days. We're about to head into January. Now is the best time to make the diet changes, to get some clarity on your lab work, to look at your biomarkers, to bring in some testing, to figure out exactly what's going on with this. And you don't have to have all the answers right now, but just know that your body wants to procreate, to take that pressure off, and to enter into 2026 with curiosity. Wait a minute, what's been missed here? And how do we be our own advocate and do this on our own timeline? So if you want to get my eyes on your specific situation, send me a message to hello@FabFertile, subject line fertile, and we will talk about options to help. Take care and Happy New Year.